I'm shy, so, please. I'm going to wear my mask today. Just discussed it with the team. Even though I've been cleared for a long time, I did go through COVID, so I'm close to a friend here, so I'm going to keep the additional mask on for the press conference. Can you hear me okay? Okay. So it's great to be with you all today. We have a couple critical updates. First of all, as General Hara and Governor have mentioned, we're making very great progress toward the 15th of October, our launch date for the pre-arrival testing program. We're going to go over our list of trusted partners, which is testing and airline partners. It's grown, and you can see these names today. I'm going to first, however, just give people a tiny perspective again, as I often do, on where we are as a state. Today, on October 7th, we had 110 new cases, 109 individuals were in the hospital, and we had 3 fatalities. Now, for perspective, 109 individuals in the hospital is a 65% decrease from our peak. And that is one of the reasons we got up to 318, that we're able to pursue a safe reopening. Excuse me. As an overview, we've had 13,045 cases over these 9 months. We have 2,309 active cases, and we've had 93 cases per day on the 7-day average, which means we've improved very significantly. Now I'm going to address our pre-arrival testing program. You've heard these details before, but we want to reinforce them. Here are the details, which begins on October 15th, the start of our program. Individuals wishing to travel to Hawaii and not require quarantine must get a nucleic acid amplification test, that's NAT, N-A-A-T, at least 72 hours before departure from their last leg of their flights to avoid the 14-day quarantine. The test has to come from a trusted partner. This is important, everyone. Please focus on this, because as people hear us, they will think, okay, I got to get that test, but it has to come from one of these trusted partners. There's a reason for that. Governor was very smart about this. We want to be more reliable and be able to check the tests. And these trusted partners have already worked through all of the details with our Department of Health, Dr. Char, to make sure that that's the test we accept. So these partners must be included. They have to do the test. We will add, by doing this, an added layer of security and safety that doesn't exist now in almost any state. None of the 48 continental United States are doing these kind of tests to get into their states. Only Alaska is also doing this kind of thing. So it's safer. And then we also want to add, no tests will be required of children under age 5. Under age 5. 5-year-olds will still need to get a test. Here are the trusted partners, as you can see right there. We've got American Family Care, which is out of Oregon. They have a bunch of sites. Color, Quest Diagnostics, Hawaiian, our dear friends, Carbon Health, CVS across the country, City Health, Urgent Care, Vault, Kaiser. Kaiser will actually pay for their members to get the test. Walgreens, Southwest, and United, and also Alaska Airlines is in the final phases of the approval process. But these are our current trusted partners, and we so appreciate them. This is how people can be guaranteed they can go get a test. And they will begin getting tests a few days, as you know, 72 hours before departure, they can get a valid test to come to Hawaii. Now, everyone knows this has been a big lift because we're trying to be extra safe. But in addition to that extra safety, we have heard and respect the mayor's desires to have extra safety. We've heard the people's desires to have extra safety, and we want to make sure this works. So what we are proposing, and we are working up now, is a post-arrival testing discussion, as you can see here, where we do some surveillance testing. Surveillance testing is testing to make sure you're catching cases of a disease. And though it may not be an absolutely traditional surveillance testing program where it's fully randomized, we want to test some of the individuals that come in with a second test. This is a way to do it. 10% of all arrivals, if we had 7,000 arrivals, which is very ambitious, I know, we would do 700 tests a day. If we had 3,000, we'll do 300 tests a day. Our priority is to focus on people that are returning. We would do it 4 days after arrival, and we would do this as a pilot to make sure that we are seeing in a rolling way that we're getting surveillance across our state on all islands, and we can see that, yes, in spite of having just one test, up front as mandatory. If it is not perfect, and we don't expect anything to be perfect, we have this additional layer of security. And I wanted to emphasize that because our hope and goal is always to have things be very safe. We do not expect a large number of travelers to be positive with COVID. The prevalence rate is pretty low on the mainland now. But by doing this, we can reassure ourselves. And then other discussions will continue between the mayor and the governor about testing processes with the neighbor islands. I wanted to add a couple other points. As General Hara pointed out, this is a very important website to go to, hawaiicovid19.com. Consider this the most important website for us to get information from, though many will use other websites too, which will share this information. The reason for this is we put a lot of frequently asked questions up there, very detailed answers in many cases, so if people are traveling to Hawaii, they know where to go and know what test to get, they know how to go through the process. So please use this. And then finally, two more things. One was, we're going to try to make sure this all works smoothly. It will be a little bumpy, although we don't expect large numbers. We'll have a beta testing program. We're finalizing the details now. The 3 days, the 11th, 12th, and 13th of October, we're going to use a couple flights in partnership with Hawaiian and one of our testing partners, Vault, so we can get people, if they would like to come and test out this program, they would do this. We hope it'll work smoothly here at the airport, and then because they had a negative nucleic acid amplification test 72 hours prior to their departure, that they would not have to do quarantine. It's so we can test out the program. And then forgive me for going on. Last thing, we had a nice moment today with Dr. Fauci, and his guidance for Hawaii was this: please wear a mask. Please wear a mask if you're around other people. He also emphasized that open air activities are far safer than indoor activities. This is reflected in Mayor Caldwell's and the other mayor's plans. You can be outside, it's safer. He also said that if you're in an indoor closed space, open a window, if that's a restaurant, other room. He liked our pre-test plan. He said it's good for travelers. He did tell us that the quarantine can't be sustained indefinitely, that it does challenge our economy, and we know that to be true. And then, in fairness, he did mention that we may consider surveillance testing or additional rapid, inexpensive testing to complement our pre-arrival program. And we want to do that. We want to send a clear message that we believe in that. We just have to make sure it's practical. So again, thank you everybody for your indulgence. We will make this program work, but we're going to all need to be pretty patient in the first few days.
And our final speaker is John DeFries, President and CEO, Hawaii Tourism Authority.
Aloha mai kako, and ame anoi anui. The industry approaches October 15th with a tremendous amount of enthusiasm and work and preparation that has gone forward to make this day happen. Every step of the way, every touch point that our visitors will come into contact with, the airports, ground transportation, hotels, restaurant and retail, all of those industries have put forth industry standards that you'll be able to find on the Go Hawaii website. Each of those standards serve as a baseline upon which I expect these enterprises to move forward and exceed the compliance measures that are in place. At the moment, tremendous amount of work is going in bringing back employees who were furloughed back in March, who are looking forward to returning to their jobs. And upon returning, they're going to learn one really important thing, that the job they had in March is not completely the same job they have today. There is a whole new echelon of responsibility that will come with every one of these jobs. And it has to do with hygiene, sanitation, sterilization, at standards that heretofore were reserved for clinics and hospitals. All in the name of keeping my coworkers safe, of keeping my work environment safe, so that I can prepare to receive the visitor who in turn must exhibit a level of responsibility and sensitivity toward our people as they come here and enjoy their vacations in the islands. This is an important step to be taken. It's not without risk. But everybody that you're hearing from today understands that, is focused on it, and is providing the kind of leadership that we are looking for in the industry. And so I look forward to the question and answer period and appreciate this opportunity. Thank you.
Thank you very much, Mr. DeFries. Now we'll move on to our questions from the media. We have two reporters here in person. Anybody with a question? Ben Gutierrez, Hawaii News Now.
And Governor, why is it more important for you to open up to trans-Pacific travel when local families are still frustrated and upset that they can't travel inter-island at this point? And why is there no plan in place after months to try to make that happen?
Certainly, the inter-island quarantine is in place to actually keep the families on the neighbor island safe. As you know, we had a surge of cases here on Oahu, and the virus activity and case count on Oahu was significantly higher than the case counts on the neighbor island. So the county mayors had requested, and I did authorize a quarantine for inter-island travel.
And a quick follow-up, Mayor Kim is still I guess, opting out of this trans-Pacific travel. From my last understanding, he's opted out.
Well, I continue to work with the mayors. I think we're all committed to the same thing, finding a safe and healthy way to bring back trans-Pacific travelers. I continue to have conversations with all the mayors on ways that we can improve the pre-travel testing program and how we can add additional layers of safety for our community.
So just very quickly, for now, the Big Island will not be taking part in this program?
No, I was not informed that the Big Island was not participating. I continue to talk with the mayor to find ways that we can improve the program.
Stuart.